Did you know that you could be at risk of suffering from hypertension without even being aware of it? Medical experts say the condition has no clear symptoms and your lifestyle choice may be a contributing factor. Mumbui Moki has the details.
40-year-old Sami Passat is a security officer at Aga Khan University Hospital. He suffers from hypertension.
Just like that.
Passat was only 28 years old when he was diagnosed with high blood pressure, a condition he previously associated with older people of 40 years of age and above.
I used to have headache, like every day I have headache, then I go to the doctor. They'll give me medication for the headache, yeah? But then one doctor by the name Dr. Kitasi decided to give me something like a graph. So she told me I'd be taking blood pressure twice a day, and then I'd be recording on that graph, yeah? Then after 1 week I went back to her, and that's the time now she noticed that I was hypertensive. And
Dr. Jailan Mohammed, a cardiologist at Aga Khan University Hospital, breaks it down.
Understand high blood pressure, you have to understand that the blood is circulated through blood vessels, and the heart pumps the blood into the main blood vessels. And the amount of pressure that exists inside those blood vessels is the blood pressure. The blood pressure can be normal, it can be low, and it can be high. And hypertension essentially means that you have high blood pressure.
Normal blood pressure at rest is within the range of 100 and 140 millimeters systolic. That is the upper level, which measures how well the heart is pumping blood into the blood vessels. 60 to 90 millimeters diastolic, the lower level measuring the amount of pressure used for pumping. Hypertension is present if the blood pressure is persistently at or above 140 millimeters systolic over 90 millimeters diastolic, which means the blood pressure in the arteries is elevated. According to Dr. Mohammed, there are several factors that can cause blood pressure.
Most people have high blood pressure because of a combination of things, largely a genetic predisposition to having high blood pressure. But your blood pressure can be influenced by other things like your size. If you're obese, then the blood pressure is higher, is generally higher. If you take a lot of salt, for instance, you can have high blood pressure. If you're under a lot of stress or under a lot of tension, then you could have high blood pressure.
I don't smoke. I used to drink a lot, but that was not the cause. Because she told me to stop drinking, I stopped for some time. And she realized that was not the cause. About the diet, I was not big as I am today. I was just around 77 kgs. So okay, she told me to reduce.
About 4 or 5% of patients have high blood pressure because there's an underlying condition with one of their organs. It could be that their thyroid hormone is excessively elevated. They are having too much of the thyroid hormone. It could be that they've got too much steroid in their body. It could be that their kidneys have got a problem that is preventing the fluid, putting too much fluid in the blood vessels.
A report released by AstraZeneca in Healthy Heart Africa in May this year, the condition does not have any symptoms. Even though it can be sustained through medication, over time it is a major risk factor for complications.
You could have high blood pressure causing problems with your eyesight and bleeding in the back of your eye. You could have high blood pressure causing problems with the kidney, and in the long term affecting the function of your kidney. You can have high blood pressure causing bleeding in the brain. And you can have high blood pressure causing so much pressure on the heart because the heart has to pump against that pressure. And that results in some patients, heart failure. So these are all
you can see me in classes. What happened in 2000 and around 2003, I had bad vision. I couldn't see you, like I can't see you even now. At say 30, after 30 meters, I can't see nothing. And this was caused by the high blood pressure.
Hypertension is a chronic medical condition, and Sami has to stay on medication for the rest of his life. The condition is expensive to maintain as well.
You should go for 3 months, okay? 25,000, 3 months. So for a year, 100,000.
Its identification is usually done through screening, and in most cases, the nurses check one's blood pressure when a patient visits the hospital for whatever problem. Mumbua Mwoki for KTN.